The chickenpox, symptoms of chickenpox and symptoms of the monkeypox are similar, but there are some differences.
Now, how is the monkeypox transmitted?
The monkeypox, as we've said earlier, is a contagious infection. Contagious means it can be transmitted from person to person. But so much peculiar with monkeypox is that it can equally be transmitted through an infected animal to an individual. It can also be transmitted through blood, through body fluids, also other materials like maybe beddings, bed sheets, clothings, other clothings. It can also be transmitted, especially within the zones where we have hunters, through these dead animals. So we have to be careful with anything, any animal that, especially in bush areas where you find it dead, it should be avoided. So these animals are such as the squirrels, you have the rats, the monkey, normally we have the name monkeypox, the gorillas. These are some of the specific animals that carry this virus through which it can be transmitted to humans.
Doctor, you earlier mentioned rashes. Does it mean any type of rash we notice on our body, it's an equivalent to monkeypox? Or if that's not the case, what are some of the symptoms to watch out for?
Right. The rashes for the monkeypox are so particular. It will start within the very first 1 to 3 days with a flat eruption, which transforms into reddish marks. We call that the macules or the macula. Those is a type of skin lesion. The macules is flat and it's a little bit reddish. Then after a few days, you find some raised bumps. Sometimes they get very hard raised bumps. These ones are called the papules. And within a day or two, these papules may be transformed into vesicles. Vesicles means you have those bumps, those raised bumps with fluids inside. Then it can equally progress to pus inside this fluid. This fluid can equally be pursy, and when it starts getting dried off, it can cause result to what we call crust. You see it a little bit black with a kind of umbilicated center resembling that of the chickenpox. So we have this kind of eruptions of these rashes. Some of the symptoms as well of these monkeypox, it will usually start, its manifestation is with fever, starts with some flu-like symptoms like fever, like you can have a temperature of about 38 or 38.5 degrees Celsius. It can go on to some headaches. Then the individual may start feeling some muscle aches, joint pains, muscle aches or joint pains over the days, and then you have this appearance of the rashes beginning. The first location on the body is usually the face. It will begin from the face, appearing on the face and going down to the rest of the body. It will occupy the palms of the hands and equally the sole of the feet. So if they itch and sometimes the pain. These are some of the characteristics or the peculiarities with these eruptions, skin eruptions from monkeypox.
In the most recent release made public by the Ministry of Public Health, it is 5 cases of monkeypox have been confirmed with 2 fatalities. Is this something to watch out for? Is this something to be worried about?
Immaculate is something to be worried about because when we see our neighboring countries like the Democratic Republic of Congo, even Nigeria, Burundi, we find these cases very high. And in Cameroon, these are new cases that are coming. So we really need to be in the watch, given that it's a contagious disease. Now, about 30 cases were suspected as the minister's communique. We read on it. 5 cases were confirmed and 2 deaths. Now, if care is not taken, preventive care measures are not taken, who knows? By the end of the year, we may record many other cases. Formerly, we will hardly hear of this monkeypox in Cameroon. So it's a kind of an outbreak or a resurgence, as Lucy mentioned. So we really need to be in the watch. And given that the symptoms are very similar to some of those diseases that we have, like the chicken pox, because you can get mixed up and it can easily find its way and kill. So we really need to be on the watch.
And now, what are some of the preventive measures recommended by the World Health Organization?
Yes. Given its mode of transmission, which is contact from person to person, from infected animals, we should keep a distance. Once a case is suspected, the individual needs to be isolated, and the individual equally need to watch out. Once you start suspecting any of these symptoms, you need automatically to isolate yourself and report yourself to the nearest health facility. Also, games like the bush meats that we find in the market, meat generally, they should be well cooked, because if this meat is contaminated with this virus and it's not well prepared, the infection can go through there, or the transmission can go through there. We equally need to do proper washing of the hands with soap. Once you suspect and you touch someone who you suspect that this could be a case, you need to wash your hands properly with clean water, with soap. Equally, even the alcohol gel sanitizers, where there is no water to wash, we need equally to use these. And we keep the distance, especially the distance. So for the infected individuals, they need to carry on their mask, because the mode of transmission equally is through droplets of maybe air, through the air. So the mask need equally to be worn by those who have been confirmed.
And we are talking about the monkeypox disease, and we also know that there are vaccines aside the preventive measures that we can have. What about the vaccines? Who are those eligible to receive the vaccines?
Given that the transmission mode is through contact from person to person, animal, we'll see that research has proven that males who have sex with males, like the homosexuals, they have a high risk of contracting the monkeypox virus. Equally, among the health personnel, they equally have a very high risk, these people who are exposed. And even the laboratory technicians who deal with the monkeypox virus, struggling to diagnose, they are equally a high risk group. So the vaccine, Genius vaccine, usually is prioritized for this high risk population. The research that has shown that especially the homosexuals, they are prioritized, especially in those endemic countries like the Democratic Republic of Congo, where the rates are very, very high. The rates of monkeypox are very high. These vaccines, though they are very expensive, they prioritize such groups, the health personnel, the laboratory technicians, those who are infected already with the infection. And usually it's administered to individuals as from 18 years who find themselves within this very high-risk population or group.
Looking at treatment for those who have been infected, is there a possibility of curing them definitely from the disease?
Monkeypox should be noted that is a kind of self-limiting disease. It means it's a disease that can go away on its own. So within a period of about 2 to 4 weeks, it can really go on away on its own. That notwithstanding, there are some antiviral medications that can be given to reduce the severity of symptoms. So specifically, there are no antiviral medications to really say this is a cure for monkeypox, but we have these antiviral medications that can help to that can be used to help with the severity of the disease. Equally, some pain relievers, symptomatic treatment is what is recommended. So if you suspect any of these cases, is to check a nearby health facility, and the health personnel, they usually will know what to do. Treatment is clinical and equally psychological.
Thank you, Dr. Glory Befeke Anye. She is a general practitioner. Thank you for honoring an invitation.
Thank you.
And of course, Immaculate Fogwe, thank you for always being there. It's always a pleasure, right?
The pleasure is shared. I'm so happy to be here.
Yeah, and ladies and gentlemen, we have come to the end of this edition of the program You and held on Equinoxe Radio. Multimedia at the technical dashboard. We had Louis Pego, Jonathan Babiola, and Raphael Dipanda. For presentation, I have been Esie Lucilengo, stay in the company of interesting programs on Equinoxe Radio and television.